Mayroom scan. Okay. So, knock, knock. Hi, my name is Caitlin. I'll be your student nurse today. Can you verify your name and birthday?
Morgan Jory, 12/10/99.
Good. Checking the wristband, doing the privacy, hand hygiene. All right. So the provider had ordered we do an abdominal assessment. So that means I will just look, listen, feel to different parts of your stomach then, okay? All right. Any allergies that I should be aware of? Nope. Okay. I won't need gloves for this as I won't intentionally be handling any bodily fluids here. My stethoscope is right here. It is clean and ready to go. Have you gone to the bathroom in the last 30 minutes to an hour?
Yep.
Okay. And you're laying flat there. Feel good? Feel comfortable?
Yep.
Okay. I'll have you just bend your knees just slightly. Good. So now I'll have you lift your shirt up. Just gonna look at your stomach here. Any recent abdominal pain?
Nope.
No. Have you had any recent abdominal surgeries?
No.
Take any medication for your stomach?
No.
Nope. Okay. So now I'm just looking here, making sure that it's symmetrical, looking at the shape, the contour of it. So lying here, the stomach is flat. I'm not noticing any bulges or masses, just like this. But can you point your head? Perfect. Still don't notice any masses or bulges like that. Also looking for any lesions, scars, or some striae, which the only thing I've noticed here is just a striae along the lower abdomen here. And then just looking at the movements of the stomach as well as the distribution of the hair across the stomach as well. So far, all looks good then. The next thing I will do is listen to the different quadrants of the stomach for bowel sounds using the diaphragm of my stethoscope. All right. So I got the right lower quadrant, the right upper quadrant, the left upper quadrant, and then the left lower quadrant. And now I'll be listening to the different abdominal artery sounds, listening for any bruits there. So starting with the aortic, which is below the xiphoid process here. Next is the renal, which is below the ribs for the kidneys. And then the other side for the other renal artery. Good. And then the iliac, which is below the belly there. Good. Another side. Oh. All right, so next I'm going to palpate the different quadrants, starting with the right lower quadrant, the right upper quadrant, left upper quadrant, left lower quadrant. So feeling for any tenderness and watching the patient's face for any pain or tenderness, feeling for any masses or bulges. The stomach is soft, good. I'm also feeling like for bladder distension, any tenderness, muscle resistance, any pain while I was feeling there?
Nope.
Nope. Perfect. You can put your shirt down. Is there anything else I can do for you while I am here? Perfect. So I've got this side rail is up, call light is within reach, and then bed low and left. Here's the table within reach, and then the room is risk-free of any hazards, doing my hand hygiene, cleansing my stethoscope here. The 5 moments of hand hygiene before touching patient, after touching patient, before any touching or after touching patient surroundings, before procedure, and then if there was any contact with any bodily fluids, I would document any abnormal findings per agency policy and will also do my own documentation into Schoology.